The thought of you or a loved one having a heart attack can be absolutely terrifying to think about. But honestly, I think what makes it even scarier is the complete unknown of what happens when you show up to the emergency room. So I want to take you through step by step exactly what happens when somebody shows up to the ER and they're having an active heart attack. The first thing that happens upon arrival is a repeat EKG or electrocardiogram. This is when they put the stickers on the front of your chest and it spits out a tracing of the heart rhythm. This alone can tell the ER doctor if you're having a massive heart attack or not. It also gives some other clues, such as the underlying heart rhythm, or even if there's any significant electrolyte derangements or abnormalities. While this is happening or soon thereafter, you're likely given a baby aspirin. Baby aspirin has antiplatelet functions, which reduces the chance of any future clots forming or any further clot propagation. If you're still having active chest pain, you're likely then given a medication to help reduce this pain, such as nitroglycerin, morphine, or even fentanyl. And while all of this is going on, the nursing staff is likely putting in an IV and drawing blood work. The blood work being drawn is really just some basic blood work, such as your blood counts, your electrolytes, or your heart enzymes. If it is determined that you're having a heart attack, you're likely started on another medication called heparin. Heparin has anti-clotting properties and essentially blocks the clotting cascade to prevent any new clots to form. Unfortunately, it doesn't break down old clots, but can prevent the chance of the heart attack worsening. What happens next is based on what type of facility you're at and what capabilities that facility has. If you're at a place that has interventional cardiology or the cardiac cath lab, this would likely be the next step. The ER doctor has likely already spoken with the cardiologist, and it's been determined if a heart attack is happening or not. They likely activate the cardiac cath lab, and you're taken upstairs for a procedure called PCI or percutaneous coronary intervention. This is a minimally invasive procedure where the cardiologist places a catheter in one of the arteries of the wrist or the groin and allows them to snake it up to the blood vessels of the heart. Once it reaches this point, they inject a dye, and the dye highlights the arteries of the heart itself and shows if there's any blockages. If there is a blockage, oftentimes they can place a stent. The stent is essentially a coil that opens up the artery again and allows blood flow to begin to flow and reperfuse the area. Unfortunately, there are times when the clot is in an odd position and it's not amenable to stenting. And at this point, it would likely require cabbage or coronary artery bypass grafting. And this often requires transfer to a large cardiac center that has cardiothoracic surgeons and other cardiologists. Unfortunately, not every hospital has interventional cardiology or has a cardiac cath lab. So, what happens if you're at one of these hospitals? Well, if you're less than 120 minutes from a facility that has this available, you're likely emergently transferred. These are ideal scenarios, but what happens if you're in really rural area that doesn't have any capability, there's nothing close by, or let's say that they try to transfer you and there's inclement weather and you're unable to get there? Luckily, there is another option, and it's called thrombolytics. Essentially, what happens is you're given a medication called TNK or TPA. This is a really strong clot busting medication, and this medication alone can break up the clot oftentimes. It's not as effective as PCI or even coronary artery bypass grafting, but it is a pretty good option. Unfortunately, it does have some side effects, as it does significantly increase your chance of bleeding. So if you have any history of significant bleeds, such as GI bleeds, bleeding in your brain, or any recent procedures, this can be pretty dangerous. So unfortunately, it's not the best option, but in many places, it's the only option. From there, you would likely be admitted to either an ICU or a cardiac care center or a cardiac care unit. And hopefully, within a few days, you're started on some more medications from cardiology. And if all goes well, you're discharged home. I know that many of us don't want to think about such terrible things happening to us or terrible things happening to our loved ones, but it's an unfortunate reality. And it's something that I see every shift. So if you ever find yourself in the position or the unfortunate position of being in this scenario, I hope this video at least provides a little bit of relief, a little bit of understanding, and helps make the experience just a little less chaotic.